Former President Jimmy Carter credits a new cancer drug for shrinking his brain tumors completely. In case you missed it, he announced that he is cancer-free earlier this week.
I went to the doctor this week for the second time. The first time I went for an MRI of my brain. The four places were still there, but they were responding to the treatment. And when I went this week, they didn't find any cancer at all. So I have good news.
Now, people around the world are asking questions about the medication. It's got a very long technical name, chemical name. It was developed by Israeli doctors. It's going to be known by you as Keytruda. We're going to talk about that in a second. But first, let me ask about this revelation that Mr. Carter says that he is cancer-free. Dr. Lickfield, who's the deputy director of the American Cancer Society in Atlanta, says cancer-free might be pushing it a little bit. It's really just that they haven't found any signs of cancer because it may be in his bloodstream or hiding elsewhere. Correct.
A lot of patients who have cancer that has metastasized to other parts of the body, we treat those patients with immunotherapy like President Carter, or chemotherapy, and radiation therapy like he had as well for his brain tumors. And then we reassess things and we do additional scanning and imaging. And those scans and imaging all have certain limitations to them. And in his case, he said that he was told that he is cancer-free. What they're really saying is that there's no sign of cancer. They cannot detect. They can't detect any cancer on the scans.
Which is good news. We're not diminishing that.
Absolutely,
yeah.
Absolutely. And I have these conversations with my patients a lot. It's always very encouraging when they're undergoing treatment and you have a scan one day and it shows they have lots of cancer, and then a few months later, after getting chemotherapy or radiation therapy or both, you do go through scans again with them and it shows no evidence of cancer. It's very reassuring that they're doing well and they're going to live for quite some time.
Let me ask you about this new drug that was developed by the Israeli doctors, Keytruda. Is it the next generation cancer drug?
Well, it's part of the next generation of drugs. It's not the next generation cancer drug. It's one of a class of drugs called immunotherapies. These are targeted therapies. And I talk about this a lot. We do have all sorts of targeted therapies. We're trying to provide personalized medicine to people and use treatments that are targeted for the certain kind of cancer. So this immunotherapy targets certain aspects of melanoma cells. Actually, it was first developed for lung cancer, and also has shown that it has a good response rate with certain kinds of skin cancers, which include melanoma. And it's very targeted for those and has a very good response. But in and of itself, it's not able to eradicate the cancer for many, many years. Many of these patients will have a recurrence of cancer later on. The hope is, however, that it keeps it at bay and it eliminates all signs of the cancer, and so the person can live many, many years without any problems from the cancer.
Any side effects from this drug?
There's side effects with all sorts of therapies, including immunotherapy. It can cause hematological problems. It can cause problems with nerves and those sort of things. And how long you keep a patient on it depends in part on their ability to tolerate it.
So what are some of the side effects?
So some side effects are...
Besides the blood problems that you alluded to.
Mainly it's problems with the blood. With
really?
Blood
Okay.
counts and those sort of things.
And how is this protocol radically different from what we used to hear about? Because it is just particularly targeting a cancer, and it was a more broader-based therapy before?
Well, it makes the body's own immune system fired up to fight the cancer. So it stimulates the body's immune system to fight this specific type of cancer. And we have other drugs like this for certain kinds of lung cancers, for certain kinds of kidney cancers. We've developed certain drugs that gets the body's immune system geared up to fight the cancer, as opposed to chemotherapy, general chemotherapy, which attacks all sorts of dividing cells.
Gotcha.
And isn't as specific. So this is targeted because it is specific to that type of cancer. And
it stimulates your body to act as an effective weapon in the fight.
Exactly.
Dr. Ackerman, always a pleasure. For more information about this new cancer drug, you can go to newsforjax.com.